Good evening, everyone. I'm AnnMarie Cronin, and welcome to our live weekly medical show on News Talk 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is with us again to tell you what you need to know about how early screening and knowing your profile can lead to the avoidance of heart attack and stroke altogether. Pre-screening and simple non-invasive tests can actually prevent Alzheimer's and many of the other chronic diseases. If you have a question, we're opening up the lines and taking your calls, so please make a note of this number, 800-859-0957. Again, that's 800-859-0957. We'll be repeating it throughout the show, and this is your chance to talk directly to the doctor. So stay tuned, and we'll be right back. You're listening to News Talk 760 WJR. Charming. We have no Facebook Live tonight, do we?
Yeah, we do. You're on Facebook right
I
now.
believe
that's
we
good
do.
to know.
Yeah, you're on Facebook.
Yeah.
We are on Facebook Live now. So what are we talking about tonight?
About the fact that you two aren't doing any work. You're on the road, and he's on vacation, and the rest of us are stuck here in rainy Detroit. That's what we're going to be talking about.
Well, we have
Well,
listeners elsewhere.
And
What?
on vacation, we're both on the road setting up the show.
That's true. That's true.
And believe me, my Ruby's here with me. My Elise, my wife, is here, and they're not so thrilled that I'm. They want to go out to eat, and I'm holding them up.
Well, I mean, you could have done a recorded show, I guess, and plugged it in, but it's only
No,
1
that's
hour.
okay.
1
That's
hour
all
out
right.
of 1 hour out of your life, you can
Live
do
is
it.
live.
That's true.
Yeah, live is live.
So what are we talking about when we come back?
A little bit of the Paxlovid experience, which has been
The what?
non-existent. Paxlovid, which is the Pfizer COVID pill.
Oh, okay.
Just a little, a touch, and see where the calls go from there. Because if we get stuck talking about prevention,
But that's what you're gonna be talking about to start with, just an update on what's going on with COVID.
well, the pill is tough to write. There's a lot of drug interactions that make it impossible to write, in my opinion.
Okay. So doctors
So-
shouldn't be prescribing it.
We have a
Really
caller,
not.
by the way, when we
You
get
have a
back.
caller? Who is it? Just tell me.
Greg
Mr.
and
Pun.
yeah,
Okay, good.
Greg and
Okay. Welcome back, all of you listeners, to our live weekly medical radio show here on News Talk 760 WJR. I'm AnnMarie Cronin, and we are back again tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. Welcome, Dr. Kolender. And you're not even here. You're on vacation somewhere. Tell the listeners where we're piping you in from.
Well, we're in Leland, Michigan right now, which is north of Glen Arbor near the dunes. So ready to have a nice quiet holiday weekend and spend some time on the beach with my wife and one of my daughters, and hopefully meet my sister and her kids. And they're staying in Manistee. So we're going to drive down to Manistee on Saturday.
How fun. And thank you for giving up the beginning of your Memorial Day holiday. Siobhan Cronin, my co-host and assistant, where are you on tour with Starset? Where did you land today that you're piping in from?
Yeah, so I'm on tour with Starset. We were, gosh, I can't even remember where we were yesterday, Kansas City, and now we're in Colby, Kansas, which is basically halfway from there to Denver. So if you looked at the very middle of the United States on a map, that's exactly where I am right now, luckily with Wi-Fi.
That's good.
And
Go ahead, Doctor.
Starset hitting Grand Rapids, so listeners can go see Starset.
I think that's in, yeah, so we're doing a festival that's in July. I'm not sure of the exact date, but if you look up Starset Grand Rapids, July, you'll find the date online.
Yeah, in Detroit,
maybe we'll do the show from there.
Yeah, why not?
There we go.
Exactly. And all the Starset members are behind you in the other part of the hotel room. And I've got my other trusted co-host here, Sinead Cronin, also taking the calls, stepping in for Olivia and Ashley, who are MIA right now. But let's get down to business. Dr. Kolender, welcome. What is the update? You're up there in Leland, Michigan, but what's the update on what's going on in healthcare, COVID, and so on?
Well, I just want to share some of my Paxlovid experience, which is interesting because this is the drug that we're being encouraged to write. And I'm not pushing it at all because I'm finding the current strains of COVID don't require any treatment other than support, meaning they need to be able to reach me so that I can adjust their plan, and none of it involves monoclonal antibodies, Paxlovid, or going to the emergency room. So we're able to handle people pretty easily with just phone calls and supportive care and just making them feel comfortable. But one of my patients really wanted to get Paxlovid, so he called and went to pick it up from his pharmacy. The pharmacist said, "Well, you have to stop your aspirin, you have to stop your statin drug, and you have to stop your blood pressure pill." And regular listeners are going to know that this is core therapy for our preventive program. Blood pressure pills that prevent strokes, statins that prevent heart attacks, and for the people at high risk for having an event, they need to be on aspirin. What drug is so important that you have to stop those key treatments while you're sick and the illness raises your inflammation panel? It's a danger, that makes things worse. It makes no sense to me. And I told him, "You're not taking that drug. You can't stop your core therapy."
So, Dr. Collin, let me ask you a question. And this is interesting to me because one of my assistants, Ashley, who's normally here, she wound up getting diagnosed with COVID for the second time and went to the doctor for something totally different because she felt as though she had an allergy and needed some allergy medication. And they did a COVID test, said she's got COVID. Now, would the doctor give her this medication? Because here was what she said to me: "I have no symptoms. I'm not sick. I don't have a fever. I tested positive." I mean, she wouldn't even have gone. She'd gone for something totally different. They said, "Well, you've got COVID." Now, would her doctor put her on this medication?
Well, why test for a disease when you
Mm,
have no symptoms?
Well, she went to
That's
see
my
it. She went for
I
an
know.
allergy. I don't know why they tested her.
Right. Why? That's what they do in the emergency room. You come in for a broken toe and they test you for COVID, and then they call it a COVID case when you don't have any symptoms. The tests are too sensitive, so they're over-diagnosing people. Sometimes they don't diagnose people at all. So I'm still treating people who come up with upper respiratory symptoms that sound like COVID as if they are. Again, it doesn't require any treatment anymore. I just have people take their vitamins.
Well, I've got Siobhan waving at me because you got two callers. Go ahead, Siobhan.
Yeah, so let's start with Greg and Shelby. Greg, what's your question?
Hey, you guys. Love it, Dr. Kolender, Mr. Positive. Hey, I'm asking something for my mom. She has COPD. She does Spiriva and the inhaler. And then after she gets done, she gargles. Does she have to gargle?
Well, no, not what depends what the inhaler is. What's the other inhaler?
What's the other inhaler, Mom? Real quick. What is it? Pro Air.
So no, she doesn't have to gargle you. The reason you gargle is if you have a steroid and you don't want to develop thrush. I would recommend that she get an inhaler called Stiolto. Stiolto. Stiolto is anticholinergic with a long-acting bronchodilator. So it's something similar to the Spiriva with a long-acting bronchodilator. It's the best. So Stiolto is a maintenance, and then albuterol or ProAir only for breakthrough symptoms.
Thank you very, very much. And everybody go for your dreams. Love you all.
Thanks for calling.
Thank you so
Bye-bye.
much. Again, thanks for calling, Greg. We do have another caller, but we'll come back on the other side of the break and take the other caller. Again, you're listening to our weekly live medical radio show where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR. And we are on Facebook again.
Back on Facebook Live.
Yeah, I do want to come back and just remind listeners that we need to keep our diligence, our attention on COVID, because the government is still mandating treatments and vaccines for a disease that does not require any of this anymore. And, we're still not being told what the side effects are, even though it's well documented that there are. So I think it's just important to let people know they need to hold, the FDA accountable, the CDC accountable, and they have to hold their elected officials accountable. So that's all. I think we need to say that every show. I hate to say it, but we do, because the government is making healthcare decisions that are legislated that should be a decision between the doctor and patient and not made by the government.
I agree.
So that's something we got to keep saying every show, because COVID's a non-issue clinically. It's just gone. Unfortunately, in the legislature, it's a huge issue because states are now making these decisions on their own, unrelated to the CDC or the FDA. Florida single-handedly, some judge in Florida single-handedly eliminated mask mandates in public areas. The CDC had no intention of doing that. Remember when they took the masks off the airlines? It was
that was like a couple of weeks ago. Mm-hmm.
Right. That was a Florida judge on her own said, I'm taking this away.
Mm-hmm.
The CDC had and the FDA had no intention of eliminating that. This was a unilateral move by one judge, and now it can't be taken back. It's phenomenal. What power do they have to make bad decisions?
Yeah, but you're talking about the airlines now. The airlines are, national, international. You don't have to wear a mask anymore, as you and I both know.
I know, but the FDA didn't make that decision. CDC didn't make that decision. A Florida district court judge did.
Well, how does that
work? And now they're gone.
And
Good
they're
question.
gone.
Good question.
How does that affect a national program? All right. Well,
it did.
Well, yeah, one.
Florida's setting a lot of trends these days. So.
That's right.
Yeah.
That's why you can't buy real estate down there anymore.
Yeah.
Anyway, we should come back to your caller first of all before we get back on the subject.
Got my timer.
If you're just now joining us, I'd like to let you know that we're welcoming you to our special weekly medical radio show on News Talk 760 WJR. We are back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. After 20 years in practice and watching patients die prematurely and unnecessarily, he's here tonight to give us some hard advice on what you ought to do to avoid heart attack and stroke altogether. We're inviting listeners to call in with your questions at 800-859-0957. Again, make a note of it, 800-859-0957. Dr. Kolender, before we come back to the subject, Siobhan, you've got someone waiting patiently.
Yes, we have David in Windsor on the line now. David, what's your question?
Yes, the comment or the question I'd like to make is about COVID shots and traveling by train or plane in Canada. The thing that I come across is that I can't figure out why they should have to force people to get vaccinated. That's a federal requirement in Canada to travel by train or plane anywhere. Because I wanted to go to an out-of-town reunion this weekend, but can't because they're requiring you to get vaccinated. And it's kind of like this kind of vaccination is no longer effective. And it's hard to find anybody, a doctor, that you can get an exemption, especially when it comes to going later this summer to a resort outside of Toronto. What can you mention about that? Because there's no reason why we should be forced to get a vaccine, to travel by train across Canada or the U.S. or by plane or whatever else.
We agree with you 100%, David. And we were just talking about this on Facebook, that I need to comment every single show that even though COVID is clinically irrelevant, to me, it's a done deal. It's a cold. There's no pills you need to take for it. You should take your supplements. You should always work on optimizing your health so that your immune system is capable of fighting whatever comes your way. But it's important for all of us to maintain our guard up, because the government, apparently, in Canada and the United States, are mandating these vaccines for a disease that basically doesn't exist anymore. And why you should have to do this in Canada and in the US, why our children are being forced to get vaccines to go to school. People have to make education decisions about what school they want to or won't go to based on vaccine requirements is absurd. And it's not these are not medical decisions that are being made anymore. And as we say on the show all the time, all decisions should be made between you and your doctor. They should not be legislated. And never should be anything be mandated that has side effect problems and causes death in some people. And they're not telling you what the risk of getting a vaccine is. So we sympathize with you, David. We're all saying move to Florida because,
Right,
they're the ones.
exactly.
I mean, we're just saying that a district judge in Florida basically single-handedly eliminated travel vaccine and travel mask mandates around the country. So you need someone to stand up in Canada and basically take the law, these laws off the table. And, what power does the FDA have when a judge can just undercut them in one day? It's pretty amazing.
It is really amazing.
Dr.
Go
Kolender,
ahead.
let me ask you, is that an option to get some sort of medical exemption, as he mentioned? Is that something that people have available to them if they can be written off from that requirement?
It's a challenge, meaning, I don't know what medical exemption is going to be valid to say that you don't need to have the vaccine unless you had a dose of the vaccine, then had a reaction to it.
Right.
And of course, anybody could say they had a reaction to it because some people died from it. So, there's a lot of people who had a reaction to the vaccine. That's a medical exemption, but who's reading the exemption, who's accepting it, I don't know what they're looking for. But yeah, there are such a thing as medical exemptions. It's
I would imagine they're few
it's
and
Not
far
worth
between.
trying, in other words.
Yeah, I mean, it's like they're few and far between, I would imagine.
Well, it's worth trying because, we're not in favor of these vaccines. So if somebody wants to try to not get a vaccine, but thankfully, unless you're a government worker, you're not being mandated to get the vaccine. And then even so, we have, again, our friend in Chicago who gets me a lot of articles. He's been able to change his job within the VA system so that he doesn't have to get vaccinated. But what a shame to take a brilliant mind away from clinical care.
Mm-hmm.
They took a genius away from taking care of people to put him into a non-clinical scenario because he doesn't want to get vaccinated. That's a loss to the vets.
Mm-hmm. Well,
I mean, it's a loss everywhere.
Yeah, I'm sure it is. Of course, it's a loss, but I mean, when people are forced to, they're not given any choice. And as you were talking, I was thinking about when preschool started, we were all forced to get the MMR and the polio vaccine, and nobody talked about what the side effects of that were or why you had to have it. And it seemed to me to be a rubbish enforcement of a ridiculous vaccine at the time. But of course, couldn't get into school without it.
Well, the difference, AnnMarie, is that those vaccines have been tested for years and years, and you had, 8 to 10 years of research behind it, studies. You had the time to recognize side effects and complications. And these vaccines were literally created and put into market within weeks of them being invented. So now they're talking about, I'm talking about these current COVID vaccines. So it's not a comparison to MMR and polio and prior vaccines because they had years and years of research under their belt where you had a good idea of what the side effects were. Now, I know the anti-vaxxers might be screaming and at the radio right now, but they had a lot more data behind them. Now, however, the FDA is talking about giving the pharmaceutical companies the right to change the vaccine at their discretion and introduce them to market without any additional testing. And that is unconscionable. Now you're going to put another new product out and not test it at all. I mean,
What
that's
would be
kind
the
of what they
FDA's
do.
reason for that, though? Like, what's the incentive?
Well, what's the FDA's reason to do anything anymore? It's money. Don't tell me that they care. They're just making money, and they're being paid for by the pharmaceutical companies. Every single doctor on the panel for the FDA is an employee of some pharmaceutical company, and they're literally handpicked to serve on the board or the advisory board that's making a decision about this or that Moderna or Pfizer or Johnson vaccine of the moment and what its indication should be.
Wow, is that a true story that you just said?
Yeah. Well, and then the doctors that disagree, they resign. Well, if they resign, they're gone. Their voice can't be heard anymore. So they conscientiously object. And unless you're following somebody on a social media platform that is willing to, put out this kind of information, unfortunately, we're not on any of those platforms. Those people are just silenced and they're gone. So you may, these doctors now they don't pick anyone that's going to abstain or not vote positive. Now they pick people who say go faster, put it out quicker, don't test anymore. So there's no dissenting voice when it comes to these decisions anymore. And it's scary for me when the whole world is under stress and you have corporate entities making decisions for us in every regard, not just medical, but now the gun lobbies making decisions for us, the pharmaceutical lobbies are, hospital lobbies are, our politicians have been bought for.
Well, let's come back and talk some more about that on the other side of the break. Again, you're listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or you have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR. And we are back on Facebook.
Mm-hmm.
You can interrupt.
Interrupt what?
Me.
Okay. I was about, you know what? Here's the thing.
You can't every time. You can't anytime interrupt because obviously I'm on a
You're
10-minute rant.
But it's easier for me to interrupt your rant when you're in here and I'm looking at you because I can always get up and walk over and just put my hand on the mic. But I can't.
But I'm looking at. I can see you better this way than I can
That's
in the
true,
studio
because you're never looking.
Facing.
That's right. Exactly.
I'm looking at the camera in the studio, and we got to tell Mark, put the camera over your shoulder. So I'm looking at you and the camera simultaneously.
Right.
Here I'm looking at both of you.
Right.
You can just, and you don't need to you just interrupt. It's okay.
I'm going to feel free. I just ran out of time, but here's one thing I wanted to say. I know, get a piece of paper and just toss it at the screen, but I was thinking about David, and I wanted to answer him back and say, listen, here's the difference. In Canada, it's all about the crown. It's all about the queen. And once you see that label on something, that's it. But they also have free, wait a minute, I'm not done. They also have free healthcare there. They don't have free healthcare here. So here you're buying it. It's a consumer commodity here. So that's what the big difference is. This is just like going to Neiman Marcus and buying a product. You're paying through the nose and through the nose again for everything, from insurance to pharma to medical care. And
I think you should talk about this on the air and just This,
And I mean, I
this is the
understand he's frustrated, but when you live in a country that's paying for everything, it doesn't matter if your healthcare is going to cost, millions of dollars. They're picking up the tab. Well, like, he can cross the border and go to Detroit if he wants to see how bad things really are.
Well, you're right, except when the government is making healthcare decisions, you want to believe that they're making the best decision for you. And that's why I'm frightened that this is their best decision. Let's give everybody an untested treatment. And when we see that it's not going well, bury the data, which is essentially what they did.
Mm-hmm.
And
but not to interrupt, how much time do I have left here? Like a minute or two? 2 minutes.
Probably about 2, yeah.
But here's the thing that I also never jump in on, that I want to jump in on, and that is because it sort of gets blown off about the MMR. There was the huge controversy about autism, and I think it was Merck that put that vaccine together, and it was the solvent in between the 3 parts that was causing all the questions, and there was an absolute huge discussion about that at the time. And then if Merck was so positive that their vaccine was safe and didn't have, side effects, albeit that they couldn't maybe be proved, then all of a sudden they just took it off the market. Boom, they just took it off the market. Nobody said anything.
Well,
and you
Merck
still have, yeah, go ahead.
Well, they've done all kinds of they had Vioxx on the market, and Vioxx they knew was causing heart attacks in people in their studies, and they buried those studies.
What was it to treat? What was it to treat?
Arthritis.
Oh, how ridiculous.
So Merck is a criminal company.
Segment 4. Welcome back to our special live medical broadcast on News Talk 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about 2 important topics: prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that number is 800-859-0957. And since we're the only show in the country that does that, we're welcoming all the people in all the states to call in. And Dr. Kolender, I might disagree with you sometimes, but I really respect your being here and being willing to talk about all these issues.
Well, thanks. And I also want to give our regular shout out to WJR, who lets us talk freely without any risk of cancellation, although they have that disclaimer at the end of the show, which I find offensive. But but if YouTube calls us, AnnMarie, it's because of what you said off the air on our Facebook time. It won't be my fault this time.
Okay, well,
it'll be yours. But we were talking. You were mentioning
the MMR
about. Not the MMR, but David, in Canada,
yeah,
his
right.
healthcare is free. Why don't you tell us what you said off the air? So the listeners
what I
can,
said is, and I sympathize with David. I understand it's frustrating, it's aggravating, it's annoying, but he is under the governance of the crown. That's the queen. That's national health. That is what it is. And I think the benefits of having national health so far outweigh what's going on here, that unfortunately that's one of the side effects that he has to pay for, is he doesn't get to go to his spa or wherever it is he wants to go to. It's unfortunate, but look at what the other flip side is. He pays for nothing, 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 and nothing, because the government picks it up. That's national health care. That's Canada. That's the queen. That's the crown, is what it is.
Well, China has national health care, and when 5,000 people in a city of 250 million, have a cold, they shut down the whole city and lock everybody down in their rooms and don't give them food. And you might say the same thing. That's national health care, and their choice is to,
wait, I'm stopping you here.
That.
No, wait a minute, stop. That is not. Yeah, that kind of sounds like Well, you're comparing China to the United Kingdom,
Canada.
or the
To
the
Canada.
Queen, or to the
The
Canada.
UK is being much more reasonable about COVID than Canada is. Canada's lost their mind. They got to get Trudeau out of there. The UK is doing a great job.
That's it. We're going to get shut off now. Talking about getting rid of prime ministers and whatnot. But no, the UK is doing a great job. But it still is. Go ahead.
But for a while, they were very shut down for a long time.
But that was a long time ago.
Right.
They looked at their studies and realized that the vaccines are not helping stopping cases, and the vaccines are not really, keeping people out of the hospital. And they changed their policy. They adapted, which is not, you might say, okay, we're adapting here, but it's grudgingly. And know that again, the idea that we're vaccinating kids with an unhealthy vaccine that doesn't require being vaccinated for the disease is, malpractice. It's we're talking about institutional malpractice that's being administered by the FDA. So it's horrific. What people want and what David wants to see in Canada is transparency and honesty. Here's the data, and this is why we're doing what we're doing. The problem is the data doesn't show any of that to justify the actions the government's taking. And so it's frustrating that's why nothing makes sense. That's why, going back to our bread and butter, why are heart attacks and strokes happening when they're preventable? It doesn't make sense. And that is because there's no money in prevention. The money's in sickness. And just like COVID, the money's in pharmaceutical products. So
that information is locked up. It's locked up with doctors that you have to pay to have access to, and you have to wait to talk to. So it's a lack of information that people can find readily.
But it shouldn't be that way. It should all be open. People should have this information available. The doctor should be practicing in a way that allows prevention, and not in a method that really just involves surgeries, devices, and pharmaceuticals. That's where everything's going. That's all the data is about: finding a product to sell and create.
Sad, no choice. I mean, what's the choice?
Well, we're back to the individual consumer. We won't call them patients. The individual consumer has to choose to get off the, conveyor belt, get off the widget machine. And, I guess I feel we should explain what a widget is.
Yeah.
The healthcare system is not really being talked about in terms of individual care. People are talked about as in a manufacturing term. How do we get more people through the system? Just like you would talk about manufacturing, how do I get more product through our production line, like a widget? And people are widgets in the healthcare system. And if you want to continue to be a widget, then stay where you are and don't complain. If you want some change and some help, then leave the system, just like doctors who aren't happy practicing. Leave the system, and there's opportunity to practice a better version of healthcare where you can help people and follow more scientific data that leads to prevention and get more people what they need. Everyone's happier.
Yeah, absolutely. I mean, it is kind of sad, and it's also kind of sad that a lot of the people that are listening to the show, or a lot of the people that live here, don't even understand what a personalized concierge practice like yours is. And yours is even more specialized because you specialize in prevention. In other words, you're saying we've got the technology, we've got the tests, we've got the time to invest in preventing you from getting the disease rather than treating it once you've got it, once you become a casualty. And that's what is sort of mystifying, is why people don't understand that, and why they are continually putting up with population medicine where they're satisfied to pay all this money for health insurance, doctor's visits, to get 5 minutes. You get 5 minutes. What can you get out of the 5 minutes?
And nobody knows. They just can't know because all the doctors are baked into the system where it's the 5-minute visit, and here's a prescription or a referral to a specialist, because I don't have time to work through this problem that you have on my own. And the reality is consultation is the answer most of the time. And going back and forth to COVID, what keeps people out of the hospital is the ability to talk to your doctor. And if you can call your doctor who's comfortable treating you without sending you to the hospital, then you can get some additional advice. Maybe I need a different inhaler. Maybe I need some steroids. Maybe I need an anticoagulant, going back to, the original strains and Delta strain. Having someone who's willing to treat you as an outpatient and not just say, well, I got a CYA. We all know what that means. CYA, go to the emergency room. It's important to have somebody who you can talk to, gain some confidence. Hey, if I have a problem, I can call my doctor again in an hour tomorrow and give us some, get us some advice. But if you don't get any advice, you don't have help, you're on your own, guess where you go? The emergency room, which is where they want you to give you drugs that don't work, intubate you, and you'll die. Let's not forget that each of those measures made the hospital money.
Yeah,
And
it's
that's why you're
really,
being
it's
sorry,
a
that's why you're
sad
being tested.
situation. And once again, like, I don't know how many 100 patients that you had that got COVID in your practice. Not one of them went to the hospital. Not one of them died. I mean, that more or less speaks for itself. You were able
And
to
it's still
treat the
happening.
COVID, and it didn't matter how old they were, whether they were 20 or 85. It didn't matter whether they had pre-existing conditions. Your record shows no one died. No one went to the hospital. No one got put on an intubator, and no one died. Speaks for itself. Obviously, you were able to treat it, and that was a far more difficult strain at the time.
No, it's all about access and care and someone who's making some effort to, keep I don't want my patients in the hospital. I don't want them in the emergency room. I don't want them going in there at all for anything.
All right. Well, it looks like we should be
Bless
taking a
you.
quick break right
Thank you.
here, right now. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subject we're discussing and you'd like to hear from the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR.
With Patriots Talk.
What happened to our clock?
I'm not sure.
We
Maybe
got-
we had a little extra time. I don't know.
No, I mean,
it's
it was
nice
just,
to know about it.
I know, it'd be nice to know
Well,
because I'm looking, were
I'll
you
check
guys,
in about it.
were you looking at the clock, seeing that it's like ticking away and nobody's
Yeah,
doing
we-
anything?
I got my own timer that I'm hitting.
I
That's
know,
why I
and
stopped talking because I'm waiting for the music to start.
I know that's what I was, who? But Blake needs to send a text message to somebody saying,
No,
hey,
no,
honey,
it's okay. He said it's all right.
it
It
is.
was his bad. Yeah.
Oh, that's okay. What is he texting you? Is he sending
Well,
you
I'm
notice?
on the Facebook Messenger.
Mm-hmm. Okay, so we're going into section 5.
What do we
Yeah,
want
but
to
I'd be
talk about?
curious maybe to come back
Wait, go ahead.
about how we started the show, the treatment you were talking about. Your doctors are getting pushed to prescribe this. What was the name of it?
The Paxlovid.
Paxlovid.
Yeah.
No, here's the
Yeah.
question that I have, and I didn't get a chance to ask it, is, so are they mandating that going back in September, little preschool kids all have to be vaccinated?
Not yet. There's a process to getting vaccines on the schedule.
But it could happen. It could happen in
Well,
June or
oh, yeah.
July or August.
All the things that are happening are steps that that lead to this being on the standard schedule. Like, and we can talk about this at, I never even looked at the vaccine schedule until someone sent me like, hey, look what all the, you don't treat kids anymore, but look at the vaccines.
Mm-hmm.
And I'm aware of what's happening with camps, and we can reference David with this, that he wants to go to a resort and he can't get there, but there's summer camps that have different vaccine requirements. And depending on who's on the board of directors of which summer camp, the camp may have a more strict vaccine policy. So for instance, one local camp has a very strict vaccine policy, and that's because there's pediatricians on the board, and the pediatricians make money on vaccines. That's like a huge part of their business. So the fact that the vaccine doesn't need to be given doesn't matter. Why does a kid need the chickenpox vaccine?
That was my question to you. Why?
Right.
Or the MMR?
I
What
don't
was the
know.
point of that? What was the point of it?
Well, MMR does make kids really sick. It affects children and it makes them really sick. And polio obviously
Well,
affects children
polio obviously is a spinal. That's
and
a whole
kills
different
them.
thing, right?
Right. So I think those are the only two vaccines, and maybe the tetanus and diphtheria, because kids are born. I mean, we can talk about this on the air, but why do kids need a hepatitis B? Why do kids need pneumonia vaccine?
Because you can't get back into school, or you can't go to camps, or you can't go.
But they don't need it. Like
But-
they it's like giving them a COVID vaccine. They don't need it.
We have a caller, by the way.
Well, we
Okay,
should
thank
take the
God.
caller. Do you want to take the caller?
Yes,
Yeah.
please.
Welcome back to the final segment of our special weekly live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, it's our last segment, so this is your chance to call 800-859-0957. Coming back, Siobhan, you have a caller?
Yeah, we have Robert in Detroit on the line. Robert, what's your question?
Hi, I have a question and a comment. First, the comment is I really appreciate the information you're giving. I'm pretty amazed. I don't listen to you every week, but I listen to you quite often. I'm pretty amazed that you haven't been banned from the radio for saying some of the stuff you do, but it needs to be said. I appreciate it.
It's the truth.
It's the truth, absolutely, and I appreciate that. The question is, so you specialize in preventative medicine. So is that like an official specialty? Is there some association or organization I can call to get a referral to somebody who performs their duties like you do if I move somewhere?
That's an excellent question, and it should be a specialty on its own. We just don't have enough doctors, but go ahead, Dr. Collin, I'll let you answer it.
Well, I thought that was a question for you. So the answer is no. I'm making my own specialty because this is what interests me, and this is the route my life has taken. So I didn't really expect to ever be here. I never expected to be on the radio. I never expected to have a concierge practice and or have the passion that I have for this. It's like a reawakening of my whole life. So I love what I'm doing, and really I'm making my own course and path as I go. So there's a handful of doctors in every state that are doing what I do, but they're doing it their own way. It doesn't mean it's wrong or right. It's just they're all forging their own way. But there's only a couple people in Michigan that are doing this, unfortunately. And I'm the only one willing to go on the air and talk about it this way. But if you are leaving the state, give me a call. I can hopefully point you in the right direction, but obviously you got to give us a call if you're here.
Yeah, absolutely. And it is, I mean, when you stop and think about it, just thinking about the United States of America having the technology to be able to prevent disease, and no one knows about it. So they don't know about the CIMT. Very few of them 20 years later know about the CT cardiac calcium scoring test. But you have the technology. Technology continues to evolve and get better. We just got the Gallery blood test out where it detects 50 different cancers before they become lethal stage 4. But no one's talking about it. But the interesting,
and it's not covered by insurance, AnnMarie.
yeah, but
that's
the
crazy.
point. That's why it's not being talked about. But I just think it's unbelievable that the UK has taken up the Gallery test and baked it into their insurance plan. But
Well,
not
they're doing
here.
research on it. They haven't baked it in. They're they're doing the research, but
But
they're
that
not
means that they're
baked in yet.
they're making the first move to get it on the agenda because it makes sense. You're better
Oh
off
no, absolutely.
finding about the disease when you can do something about it, eradicate it. And this specialty of prevention is just, it's amazing that it's not more prolific. But unfortunately, people are so intimidated by the fact of, oh, if it's not covered by insurance, my doctor's not going to recommend it. I don't need to get it. And yet the technology is there. And it's unfortunate that everybody has to be their own advocate. They have to do the research. They have to find out about these tests that you do and other prevention doctors do. But unfortunately, there's so few of you around because it's an uphill battle trying to convince people that, they always say America's the greatest country in the world. Well, if it is, prove it. You know, let's all take advantage of the fact that you have this capability here to prevent disease and find out more about it. But unfortunately, patients their own advocate.
Well, I think it's pretty incredible that the whole country really has fallen in step with the concept that if it's not covered by insurance, it's not needed. And
Yeah,
you
how does
can't break
that
through
even?
that.
I mean, that's impossible to break through. But I mean, it's amazing to think about the fact
Well,
that
it's decades. It's decades of messaging. It's decades of training doctors this way to have this thought process. The med schools are training doctors this way. So if you have a med school class of 150 people graduating, there might only be one or two people coming through with a mindset of, I want to forge my own course and not look at, the system which isn't working. Every other doctor has been brainwashed to the system, and also they're not being trained to do anything but operate within the system.
Mhm.
That's why everyone's going to be hospital employees. You just can't go out and start your own business anymore.
Well, it's also so immensely expensive to become a doctor, to go through the tuition and everything. So, I mean, I can imagine in other countries where it's more, you also have education provided for. So you're investing less and therefore you probably have more freedom to choose what you want to do without the
It
worry
all
about
yeah,
paying back your debt.
it all plays into itself. Let's make med school really expensive. Let's overpay the residents coming into the job force a salary that they never make starting their own practice, even though they're not earning that money. It keeps them out. It keeps them in the hospital system.
Mhm.
Um, it's just a self-perpetuating thing that is really well thought out between the hospital lobby, again, all of our great people, the hospital, the pharmacists, the device companies, the FDA, and the insurance companies. They've got us all locked in to a broken system that wants us sick. They make more money when you're sick.
Absolutely. But I mean, it's just amazing to stop and think about the fact that patients need to start thinking about themselves as consumers and they have the right to know what's out there, whether it's covered by insurance or not. They have the right to know what is out there that can prevent serious disease, Alzheimer's, heart attack, stroke, all the things we talk about. Siobhan's waving to me. Do you have a caller?
Yeah, before the segment ends, let's go to Bill in Lansing. Bill, what's your question?
Yes, I wonder if any doctor offices are now using artificial intelligence programs to diagnose, rare diseases.
Well, you see commercials about Watson being used in this way, and there are some systems, with regional hospitals that are working on this. I mean, obviously, that's not my bailiwick. I'm more on the let's find AI to identify people who are at risk so that we can stop things from happening. But the rare diseases are rare. But there are some AI. Uh, that's the attempt, is to make AI find these, not just that, but anything. Problem is that the human element just can't be accounted for a lot of times. I think that's a issue that they're having.
Well, once again, as we're getting ready to close, this the same old song is heart attack is preventable. 700,000 people died. A few more people every week. You hear about somebody dropping dead of a heart attack, and it is preventable. And nothing is going out there to say how and what do you do to make it preventable. And that's, the sad story here right now.
And like you say, AnnMarie, it's simple, stupid. It can be done very easily. It just doesn't make anybody any money, so nobody wants to do it. And that's the crying shame at that the testing is old. You know, the lab work we use is new and sophisticated, but the imaging is old.
So you just need to be your own advocate. Unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance, the necessity of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information tonight on how to be your own advocate. Take charge of your health, whatever your medical journey. Please continue to tune in to our shows Sunday afternoon at 3 p.m., Thursday evening at 7 for the latest medical updates. And thanks for listening to News Talk 760 WJR. Thank you to my co-hosts, Siobhan Cronin and Sinead Cronin. Good night and be well.
Opinions heard in the preceding program